We believe that the best companies are built when the founders resonate with the consumer's problem. Both Rohit and I have gone through our own journey of MSK pain, rehab, and recovery. Through our own journey and also understanding the gaps in the market, we realized that the right combination of evidence-based scientific protocols, the right use of data and technology, we can create an outcome-based solution that works for the entire ecosystem, both the consumers as well as the practitioners. The different MSK disciplines follow a clinically backed science which work in a continuum. Step 1 is where we diagnose if the patient has any structural MSK damage. In this case, an orthopedic surgeon will step in and then define the line of treatment. Step 2 is where if there is no structural damage, then the sports physio will identify the root cause of pain and then work on pain management and improving mobility. And then step 3 is when a strength and conditioning coach comes in and works on improving strength and return back to any sport or activity. Now, across all of these 3 steps, the cutting edge technology and the data backed systems that we use, it actually helps in unifying all of these steps of the process. While pain can be solved for in a short time period, it is imperative for customers to follow an active rehabilitation protocol over a longer period of time. It is typically spending 30 to 45 minutes of time, 3 to 4 times a week over a longer duration of time. While it does sound quite simple, but it's actually quite difficult to achieve in real life. And it's for 2 key reasons. One, it's difficult to get to a physical location for this longer time period. And 2, it also starts becoming very expensive. And this is exactly where our AI-powered technology comes in. Customers actually get an app where they get the protocol that they need to follow in terms of doing the exercises. 2, they get very clear feedback when they're doing exercises in terms of what they're doing right or wrong. Most importantly, this data goes back to the physiotherapist and the strength coach, and they can actually revise programs at a frequency of around once a fortnight or once every month. And that really actually helps the customers to build this program and run it over a longer period of time. This actually is quite simple. In the first phase of reassess, the whole idea is to keep ourselves and also the customers in return extremely accountable to the objective metrics that we have set. So what happens is in the first session itself, we do a baseline of the metrics and then set goals along with the customers to know what do we really want to achieve. The second phase is restore, where the focus first is on the management of pain. So it means either completely reduce pain for the customer or probably reduce the symptoms or the contributing factors of pain. Once the pain is managed for, then we start working on improving mobility and getting some basic strength in place as well. Then the third phase, which is of reignite, is where actually we start putting customers outside of their comfort zones into actually starting to do some activities. Now this could be actually playing a sport, or it could be, doing like a 5K or a 10K, whatever, or it could actually be also going for a trek, right? Whatever that the customer feels is most relevant for him or her. During this process, there are a few things that we work on. Firstly is actually building muscle capacity, which in very layman terms could be said like, going from strength to strength, right? So that is where we actually work on improving a lot of strength across different muscle groups of the body. The second is actually starting to work on a lot of stability, because when we start doing a lot of activities is where your stability of the body becomes very, very important. The third piece which we have seen, which is very critical in this phase, is actually doing a lot of corrections and a lot of things that were going wrong with the customers before. So there are typically a lot of weaknesses or things that you were doing wrong in terms of how you are doing some of the movements. That is what we work on during this phase. As a part of our assessment process, we use a very strong clinical reasoning system, and then in addition to that use tools like VALD, RunScribe to actually do a series of tests. One is around range and mobility, 2 is around isometric muscle strength, and 3 is functional movement analysis. As a part of all this testing that we do, we actually are able to do the following things. One, we are actually able to find out the underlying causes of pain, and 2, then the sports physio and the strength and conditioning coach are able to create a very customized and tailored program based on the findings from the tools and technologies that they have used. Let me answer that question in two parts. The first part is how the solution follows a very multidisciplinary team approach. So that is where an orthopedic surgeon, a sports physiotherapist, a strength and conditioning coach all come together to create a very comprehensive solution for the customer. The second part is how we actually work with everyone in the ecosystem. So be it doctors and hospitals, sports teams and associations, and corporates to actually look at different types of conditions as well as provide solutions that are very customized. If you see, what we are trying to do here is to actually collaborate and work with the ecosystem and not disrupt the ecosystem. And we believe this is the right way in providing a solution that works for the consumer, but also most importantly, it will also help the ecosystem and the practitioners. This actually has been fairly interesting for us to solve. When we started Stance, we initially did extensive research with both practitioners and customers, and what we found is that the entire process is more an art than a science. However, if you actually look at the process and the methodology that goes into rehab and recovery, it is extremely scientific. And this is where our data backed technology helps us to convert this art into a science. The single largest challenge, even for us, while we are building this, has been to actually find the right time and the discipline to actually bring both the clinical science as well as the technology and the data together. But over this period of time, we've been able to build a very strong clinical decision science system, which puts all of the elements together, ensuring that customers get very high quality of care and the best in class outcomes. Technology will play a key role in the following four ways. First, in making the entire diagnosis process extremely data backed and objective. And to be honest, if we can really make this a standard, imagine the way we have blood reports today. If you could actually get a similar report for your MSK health, that's what we are trying to do with technology. The second point is how we can start using a lot of this data and use advanced technologies to tailor and customize programs for customers. Third is how we can actually create an EMR plus a diagnostic toolkit that really starts becoming a standard and can be used by everyone over a longer period of time. And if all the three things that I said above work together, then fourth, we can actually create a system which can start predicting risks and outcomes. This actually is a very important piece of our customer experience and operations. So we do this through a few steps. The first step is the entire training program and the process that we have created. So in fact, the communication and how the one-on-one experience for sessions should be is a very integral part of our training program itself. So everyone new who joins the team goes through that program to sort of understand how they're supposed to communicate with customers and the human touch. The second point is that we actually do a lot of customer feedback surveys every month. So between me and my co-founder and the founding team, we talk to at least 25 to 30 customers every month. And what we understand is minute things that we need to change in our communication, in the experience in the center, so that the entire field becomes very relevant for the customers. The third thing is actually the hiring itself. So as we sort of continue to expand the new people that we have hired over a period of time, we have ensured that there are a lot of non-negotiables that go in, so that the type of people that we are getting in actually firstly fit into our culture, and then that's the sort of culture that they'll also demonstrate when they work with the customers. The current acceptance rate of the hiring, hence because of all of these non-negotiables, is only 7 to 8%. That means that we hire the right talent for the experience that we want to provide to our customers. There are actually multiple things, but let me pick the top three things that are very critical for us in the short to mid term. And I think we'll get a lot of joy and satisfaction if we sort of achieve that. The first thing is actually creating an academy of top sports physios and sports science coaches, because that's what we really feel is going to stand out for us over the short to mid term at least. So that effort has already started. So once we reach a point where we have our first 25, 30 people who are really best in class, 100 percentile in terms of what we are doing, I think that will give us a bit of satisfaction there. The second point is, while the process and the protocol and the systems that we've built, and we've seen outcomes for hundreds of patients today. But I think a point when we're able to reach around 1,000 plus customers, and if we're able to really document this and put it down into a paper, imagine 1,000 plus people with chronic low back pain, and how has our process and system really helped them. And that is when I think this system can really become mainstream and standardized. I think that will give us a lot of joy and satisfaction again. The third most important fact is how we are trying to create this into a more comprehensive, verticalized, collaborative sort of a solution. And that is where we understand the importance of course, what we are building, but also how it is critical to partner with orthopedic surgeons and create like a co-branded offering. So we're already working towards that. So I think when we have the launch of our first co-branded center, which is along with an orthopedic surgeon plus stance, I think that again will be a very important milestone for us. So those are the three that I'll pick up. Just to summarize, first being an academy that we want to create. Second is like a paper of 1,000 plus customers who have undergone our protocol and seen great results and outcomes. And third, the launch of a co-branded stance plus a doctor store that will give us a lot of joy. Thank you.